Okay, thank you very much. Good afternoon, everyone. Dr. Williams was unable to join me today due to other commitments. It has been a few days since we last provided an update, so I'm going to spend a few moments going over some of the numbers, and then we'll open it up to questions. We now have a total of 28,263 confirmed cases of COVID-19 reported in Ontario. Over the weekend, the increase in cases was in the low 300s, 323 on Saturday, 326 on Sunday. We have jumped just over the 400 mark today with an increase of 404 cases, which is 1.5% increase over yesterday's report. Of these 404 new cases, over half are from Toronto, 120, and Peel, 103. The number of healthcare workers who have tested positive is about 17% of all cases, 4,730. Again, a cumulative number, not representing those currently positive. The number of Ontarians who have recovered from COVID-19 now stands at 78% of cases, or 22,153. Currently, we have 781 people in hospital. Of them, 125 are in the ICU, and of those, 89 are on a ventilator. And tragically, we do continue to see deaths related to COVID-19. To date, we have 2,276 deaths reported, representing an increase of 10 deaths from the previous report. With respect to long-term care homes, according to the Integrated Public Health Information System, we have 181 active outbreaks currently in long-term care. We have a cumulative total of 5,097 confirmed cases in residence and a cumulative total of 1,814 cases in staff. 1,445 deaths have been reported in residence and 8 deaths for healthcare workers. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, we have currently 41 retirement homes in outbreak and 191 deaths reported. In respect of laboratory testing, a total of 732,722 tests have been completed in Ontario. In the last day, 14,379 tests have been done, and 6,427 tests are currently under investigation. So that's it for the numbers. I hope everyone managed to have a good weekend and keep your social distancing. I was out with my husband a bit, and I saw a lot of people complying, a lot of people wearing their face mask and keeping at least 2 meters or 6 feet apart, which is really good. And hopefully we'll continue to have good compliance with public health measures and keep working to keep the numbers down. So with that, I will turn it over to the questions.
Okay, we'll move to the phone line for questions. Just a reminder, 1 question, 1 follow-up.
First question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Doctor. The Premier mentioned about 80 or 81 cases in migrant workers in southwestern Ontario. So are all those 80 in this number of 404 today? And what's being done about getting on this migrant worker issue, since they live in close quarters in bunkhouses?
Yes, certainly temporary foreign workers have come into Ontario, and they're a very important part of the farming industry in Ontario and food production, and very essential workers providing essential duties in the province. We do have, the province has put out guidance around public health measures for temporary foreign workers, and the public health units are all working with their farmers and with the Ontario Ministry of Agriculture and Food and the Ministry of Labour to ensure that appropriate measures are in place to help prevent infection and spread. And in some cases, in fact, the local medical officer of health has issued orders under the Health Protection and Promotion Act in terms of ensuring that anybody with symptoms is isolated and that the accommodations are appropriate for that, and environmental cleaning, things like that. So I do understand there is a confirmed outbreak in Haldeman, Norfolk, with 85 individuals who have tested positive, 25 symptomatic workers, and 5 workers have been admitted to hospital. And the local health unit, as I said, is working very closely with the employer to ensure that the effective mitigation measures are being taken.
Follow up?
Okay, thank you. And just to change gears a little bit, some of the regulatory colleges for medicine, for example, massage therapy and chiropractors, they're telling their people they can get ready to open. Why can we have chiropractors and massage therapists working but not hair salons and barber shops? I'm just curious about that because you do spend time, a fair amount of time with all those people, and some have been cleared and some have been not.
Well, I mean, without going into specifics, certain regulatory colleges are covered under different legislation, and they're providing health care, and they're covered under Directive 2 from the ministry. So they would have to fulfill the health requirements to ensure that they are not posing a risk either to their clients or to themselves. I think consideration of hairdressers and so on, I know it's something that everybody's very interested in, and certainly is part of the consideration for future phases of opening, but at this point it isn't.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hello, Dr. Yaffe. Earlier today during his news conference update, the Premier suggested that it was too soon for family members to go into long-term care homes to visit their loved ones. And he said it could be another month, even 2 months, before that could happen. Is that your assessment, that families may have to wait up to 2 more months before they can actually see their family members?
Well, I know this is certainly a very important issue. And it's something that, as I sit on the long-term care IMS, Incident Management System table, we are considering visitation policies and family visitation policies. It's a balance of the importance of the mental, social health, psychosocial health of the residents, and of course of their family members, and the physical health. And obviously we do not want to take a chance to introduce COVID-19 into the facilities that have such vulnerable populations. On the other hand, as I say, mental and social health are extremely important as well. So I don't know how long it will take. I'm hoping it won't take as long as a month. And certainly whenever we do permit it, it would be under specific conditions. And we would not allow just open visiting. So there are a lot of considerations to be considered, and we would need to look at the policy and ensure that it's done in a very careful way and monitored. But I'm hoping it won't be as long as a month.
Follow up?
And I know I asked you this last week, and I apologize. I'm going to ask again. Alberta and Quebec have opened up some of their visitation requirements, and people can either drive up or they can go visit them outside. Many of these places have courtyards. Why can't that happen now?
I mean, I can tell you that the senior staff at the Ministry of Long-Term Care have done extensive consultation with stakeholder groups, and I know that that's one of the suggestions, that the visits be allowed outside like a courtyard. So that's certainly under consideration as one of the options.
Next question.
Next question comes from Alison Martel from Reuters. Please go ahead.
Thank you. On that Haldeman, Norfolk outbreak, which I understand the mayor is now saying has reached 120 cases, what makes that a confirmed outbreak, I believe is your phrasing. And in general, can you help us understand what policies or rules ensure that local public health units identify workplace outbreaks?
Well, a confirmed outbreak, basically, I mean that it's been identified as an outbreak by the local public health unit. They're treating it as an outbreak, and an outbreak basically means that there are more cases than expected. Although certainly one wouldn't expect any cases. So, are there any specifics, directions to a health unit about the definition of an outbreak? Is that what your second question was? No, I mean, it's a basic tenet of public health epidemiology that an outbreak is basically more cases than you are expecting in a particular population, time, place. So it's basically time, place, and person. If you have a congruence of those factors, that the same kind of people or type of people, population in a certain setting in a certain time period have more illness than is expected, that is considered an outbreak.
Follow-up?
So even if there are no additional cases, it sounds like we're looking at least a 60% attack rate, which I understand to be pretty high. And what is Ontario going to do differently to prevent outbreaks like this in the future?
Well, you're right, 60% is a high attack rate, and it's a concern. And I think that, as I said, we had put out guidance for temporary foreign workers, for the medical officers, for the Ontario Ministry of Agriculture, and for the farmers. And I think that we need to learn from our experience and consider whether we should be looking at different policies for next year.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Dr. Yaffe. Just to quickly follow up on the questions about the migrant workers, Rob Ferguson had asked if those 85 cases are reflected in today's 404 new cases. Do you know?
I cannot say for sure. I would have to check.
Okay. My other question is also about the numbers. Is it too early to say if the uptick that we've seen today is as a result of the nice weather that we had last weekend and some of the larger public gatherings, such as at Trinity Bellwood?
Well, I mean, certainly we can hypothesize about why there's been an increase. And part of it is we'll be looking at where the increase has been. And as I said, it's been particularly in Toronto and Peel. So, whether people were out more and perhaps not following social distancing as much as they should have been, that would certainly be a contributor. And, although we all want nice weather, but we have to be careful and keep to the social distancing and encouraging people to wear a cloth mask if they cannot maintain the social distance.
Next question.
Next question comes from Ashley Legasic from News Talk 1010. Please go
Hi,
ahead.
good afternoon, doctor. My question is regarding a report out of Europe today. Several doctors in Italy have declared that COVID-19 is virtually non-existent as it's mutated and become weaker through transmission. Have we seen anything like this in the province?
I haven't seen that report. That's very interesting. I'm aware the virus does mutate, as most viruses do. Has it become weaker? Not that I've seen. I mean, we're still seeing people hospitalized. We're still seeing deaths. Certainly mostly in people who are older or who have underlying morbidities. It would be nice if that were true. I haven't seen any evidence of it.
Okay. My follow-up is kind of piggybacking off Allison's last question about the large protests we saw in Toronto this past weekend. There were thousands of people there. I do note a lot of people were wearing face masks, but I'm wondering if you're concerned about a spike in cases at all from this.
Am I concerned about spiking cases? Obviously, we're very closely monitoring the numbers, and we don't want to see any more increases. We don't want to see spikes, I think that if people were very close and they weren't wearing masks, there's always the potential risk for transmission. Especially, we know that it can transmit when somebody has no symptoms. So I think people just need to be cognizant of that. And if they were in that crowd, they have to watch now for signs and symptoms for 14 days, which is the incubation period can be from 2 days all the way up to 14 days. And if they develop symptoms, they should be going to an assessment center to get tested.
Okay, we're going to move to the last reporter.
Last question comes from Mo Fahim from Vista Radio. Please go ahead.
Yeah, hi doctors. Can you hear me well?
Go ahead.
Perfect. So my question is a bit technical in nature. My question is about nitric oxide. A lot of reports and a lot of articles are popping up about the possibility of using nitrous oxide to enhance, I guess, the ability to take in more oxygen for COVID-19 patients. Can you tell me if Ontario has done any research on this, and what's your personal input on this?
Well, I'm unaware if there's been research in Ontario. I saw the media coverage that you mentioned by myself. I think there's a lot of different things that are being researched, and hopefully we'll come up with something that actually works and helps the cases in terms of treatment, and obviously, hopefully, eventually a vaccine that's safe and effective. So I'm not aware of any specific research on nitric oxide in Ontario, but we do keep up to date in terms of research, and if there's anything that helps, then we'll hopefully get it in Ontario.
Follow up, and this is the last question.
And my follow-up question is, considering that Canada, like a lot of provinces, including Ontario, have seen outbreaks occur in large, I guess, processing facilities. Very little, but still like a couple happening here and there. Is the province considering anything like the long-term care testing survey for these processing facilities to be on the safe side and make sure that everyone, make sure that there aren't any asymptomatic people currently spreading COVID-19?
We are, Dr. Dirk Heyer has been working as the lead for the province on testing policies and looking at testing various workplaces. So I would suspect that food processing would be one of the types of workplaces, given there have been outbreaks and certainly in other provinces and a bit in ours. But I just want to caution that testing in itself is not enough. It's about having clear policies about people not going to work when they're sick. It's about having hand washing facilities or alcohol-based drug hand sanitizers. It's about having environmental cleaning. It's about having policies in place for occupational health and safety. And testing, of course, is an adjunct that can be important in this circumstance, but is not the only thing.